Hi, I'm Dr. Rob Danoff with Aria Jefferson Health for medical news that you can use. You know, our bodies talk to us. Maybe we've exercised more than we usually have, so we get some muscle aches and joint aches. Maybe it happens that day or the next day, and we said, oh yeah, I know what that's from. But what about other body signs? Could they mean something? For example, handwriting. Do you know that sometimes a change in handwriting can indicate there could be a problem with our coordination or our neurologic system? For example, if we know how we normally write, but we notice it's starting to get smaller and it's not the same that it used to be, that can indicate a tremor is starting to come on, or maybe a neurologic problem like Parkinson's. Now, I'm not saying that's going to occur, but look for changes in handwriting. Breath. Yeah, sometimes we do have a change in our breath, especially after we eat something or if we have a sinus infection. But what happens if our breath starts to smell like fruity? It smells like an acetone type of thing. What does that mean? Well, maybe it's a sign that our blood sugar is out of control. That could be diabetes. And what about our bowels? You know, a lot of times we don't like to talk about our bowels, but hey, it's a part of life, right? We know how often we normally go to the bathroom. But if there is a change in your stool, if it gets thinner, if there's any blood, if you get any unexplained abdominal cramping or pain that's pretty consistent, that's unusual for you, please get it checked out by your doctor, because that could be a sign that something's going on with your colon. And what about urine? We know how frequently we urinate. What happens if you're a guy and you're starting to get a little bit age gifted? Are you waking up a lot in the middle of the night? Maybe you can't urinate as strong with your stream as you used to. Maybe it's your prostate. If we're urinating more frequently than normal, could it be diabetes? Could it be an infection? This is your body telling you, hey, let's maybe get this checked out. And what about going up and down stairs? We know how we are. Do we get short of breath? Are we able to do it okay? What happens if there is a change, that we're starting to get more short of breath, or we're having trouble going up or downstairs? These may be symptoms that our body is starting to say, hey, I'm letting you know that something's not right. Maybe your lungs aren't working as well. Maybe you have COPD, you can't get as much oxygen. Or maybe your heart isn't doing a good job like it used to before. So any changes in exercise tolerance, you know yourselves. Let's get it checked out. Again, it doesn't necessarily mean anything bad, but it's good to check out. What about dizziness? You get up from sitting and all of a sudden it's like, whoa, what does that mean? Sometimes it's just standing up too quickly. But what happens if we're lightheaded a lot, or we feel weaker than normal? Are we anemic? Do we have a low blood count? Something to check out. And lastly, it's wintertime, right? Any of you have dry skin? Any of you have itchy skin? Well, sometimes itchy is the first sign of dry skin. But what happens if your skin's not itchy, but it's starting to get really dry and flaky and thicker in some areas? Maybe it's your thyroid. Maybe it's an autoimmune disorder that's starting to go on. So we just need to listen to our bodies, write it down, and then when we go to the doctor, we can say, hey doc, this is what a change has been occurring with my body. What do you think it is? So you partner with your doctor and we work together to try to help us all for better health. This is Dr. Rob Danoff for Aria Jefferson Health.